The nation's top public health agency, the Centers for Disease Control and Prevention, is in a state of turmoil. Its new director, Dr. Susan Monares, was fired after less than a month, sparking a wave of resignations from senior scientists. Now, a new acting director is in place, Jim O'Neill, and he faces immediate, high-stakes decisions about the country's vaccine policies. The crisis began with the firing of Centers for Disease Control and Prevention Director Dr. Susan Monares, an infectious disease expert who was confirmed by the Senate in July 2025. According to her lawyers, she was removed after refusing to rubber stamp unscientific, reckless directives from the Trump administration. The core of the dispute was her refusal to commit to approving changes to United States vaccine policy without first consulting her scientific advisors. A White House spokesperson stated Monares was terminated because she was not aligned with the president's agenda of making America healthy again. Her legal team is contesting the firing, arguing that as a Senate-confirmed appointee, only the president can legally remove her. Dr. Monares' ousting triggered the protest resignations of at least 4 other high-level officials: Dr. Deborah Howry, the chief medical officer; Dr. Dimitri Daskalakis, the director of the National Center for Immunization and Respiratory Diseases; Dr. Daniel Jernigan, who led the National Center for Emerging and Zoonotic Infectious Diseases; and Dr. Jennifer Layden, director of the Office of Public Health Data, Surveillance, and Technology. In their resignation letters, they cited political meddling that undermines science, an unscientific vaccine recommendation process, and the weaponization of public health. Hundreds of Centers for Disease Control and Prevention staff held a clap-out to show support for the departing scientists who warned that the new policies could cause harm. Into this leadership vacuum steps Jim O'Neill, the new acting director. O'Neill is not a doctor or a scientist. He is a former biotech investor and a longtime associate of tech billionaire Peter Thiel, with a history in the George W. Bush administration's health department. His appointment is seen as a move to align the Centers for Disease Control and Prevention with the agenda of Health and Human Services Secretary Robert F. Kennedy, Jr., a well-known vaccine skeptic. O'Neill himself has a history of criticizing health regulations. In 2014, he argued that drugs should only need to be proven safe, not effective, before being approved for public use. During the COVID-19 pandemic, he publicly supported unproven treatments. During his confirmation hearing for the Deputy Health and Human Services Secretary role, O'Neill stated, "I support the Centers for Disease Control and Prevention's recommendations for vaccines," but he also defended Secretary Kennedy from criticism. The immediate challenge for O'Neill is a critical meeting on September 18th of the Advisory Committee on Immunization Practices. This is the expert panel that provides the scientific recommendations for all vaccine use in the United States. Secretary Kennedy has already reshaped this panel, replacing all 17 members with his own appointees, a move that has drawn criticism from scientists and medical groups. On the agenda for this upcoming meeting are reviews of long-established childhood immunizations for diseases like measles and hepatitis, as well as updated COVID-19 vaccine recommendations. The administration has already restricted the new 2025 to 2026 COVID-19 vaccine to only high-risk groups, a significant change that has created confusion for patients and pharmacies. Dr. Monares was fired for refusing to pre-commit to signing off on whatever this new panel recommends. The decision to approve their findings will now fall to O'Neill. The stakes are incredibly high. Departing CDC officials and public health experts warn that political interference could undermine decades of progress against preventable diseases. The turmoil is also eroding public trust in the CDC, an agency whose authority depends on its scientific independence. The situation has drawn rare bipartisan concern, with Republican Senator Bill Cassidy, who chairs the Senate Health Committee, calling for the upcoming vaccine advisory meeting to be postponed, stating any recommendations from it would lack legitimacy. The crisis at the CDC not only impacts domestic health, but also poses a global risk, as the agency's ability to track and contain international outbreaks could be severely hampered.